Hi friends, this is a presentation about neurotic and psychotic disorder. Personality. What is personality? Personality is a person's unique pattern of traits. It includes everything about the person, his physical, emotional, social, mental and spiritual makeup. So, as we all know, some characteristics of an individual's personality are inherited and some are shaped by life events and experiences. A personality disorder can develop if certain personality traits become too rigid and inflexible. So, we all know abnormal psychology is a branch of psychology that deals with the study of psychological disorders. We can consider these disorders, be they mental, emotional, or behavioral in nature, to be the things that negatively impact a person's life experience. As a result, the life experience of those around them can also be significantly affected. Here we are going to focus on two personality disorders. The first type is neurosis and the second type is psychosis. Neurosis and psychosis are different types of mental disorders. Neurosis is a mild mental disorder not arising from organic diseases. Instead, it can occur from stress, depression, or anxiety. Psychosis is a major personality disorder characterized by mental and emotional disruptions. It is much more severe than neurosis, often impairing and debilitating the affected individual. So the first branch we are going to look at its neurosis. Neurosis is a very common type of disorder. It is quite common among people. People are generally aware of their condition. For example, lots of people feel anxious from time to time. You might get a knot in your stomach before a job interview, stress about money, or fret if your child isn't home by curfew. It's normal part of being human, right? But what if your extreme worry doesn't go away? Negative or obsessive thoughts can take over to your mind to the point that it's hard for you to handle everyday situations. That's called neurotic behavior. The line that divides neurotic from normal is the intensity. Some of the major characteristics of a neurotic disordered person are: neurosis involves sadness, depression, irritability, anxiety, anger, confusion, and so on. We can say that neurosis is the inability of a person to change their life pattern and unable to develop a more complex, satisfying personality. A person suffering from neurosis faces an unconscious conflict and emotional distress which leads to different mental problems. Neurosis can happen to a person who has been through a traumatic event, and the thoughts of the events make it difficult for him to forget the incidents and cause anxiety, which is primary symptom of neurosis. How neurosis can be treated? Psychologists and psychiatrists conduct the treatment of neurosis in various ways, helping the ill person to start being aware of feeling traumatic memories, repressed impulses that cause the symptoms, and then healing the person to have growth in his personality by deeper self-understanding. A person can also be cured by watching or learning from examples, Replacing those negative thoughts with better interpretations of surroundings can be quite useful in curing neurosis. The conventional way of providing medicines can also work for a neurotic patient. Types of neurosis. It is divided into three branches: affective disorder, anxiety disorder, and eating disorder. Affective disorder is mainly about depression. Unipolar. It's a major depressive disorder, a mental health disorder characterized by persistently depressed mood or loss of interest in activities causing significant impairment in daily life. Bipolar, a disorder associated with episodes of mood swings ranging from depressive lows to manic highs. Postnatal, which is common depression that occurs after childbirth. SAD, seasonal affective disorder, a mood disorder characterized by depression that occurs at the same time every year. Seasonal affective disorder occurs in climates where there is less sunlight at certain times of the year. Anxiety disorder, phobia, it's the fear of certain things. OCD, obsessive compulsive disorder, is characterized by unreasonable thoughts and fears or obsessions that lead to compulsive behaviors. For example, Fahad Fasil's character in the movie The North 24 Kadam. PTSD, post-traumatic stress disorder, a disorder characterized by failure to recover after experiencing or witnessing a terrifying event. Stress is a normal reaction the body has when changes occur, resulting in physical, emotional, and intellectual responses. Panic attacks. Eating disorder is a mental disorder defined by abnormal eating behaviors. Anorexia. Anorexia is an eating disorder causing people to obsess about weight and what they eat, restraining the food one eats. Bulimia. Bulimia is a serious eating disorder marked by binging followed by methods to avoid weight gain. Psychosis. Psychotic disorders are a group of serious illness that affect the mind. They make it hard for someone to think clearly, make good judgments, respond emotionally, communicate effectively, understand reality, and behave appropriately. When symptoms are severe, people with psychotic disorders have trouble in staying in touch with reality and often are unable to handle life. Compared to neurosis, psychosis is much less common and much more serious or severe. It can also be extremely difficult to treat. People are not aware that they are suffering from a problem in case of psychosis. People suffer from psychosis often hallucinate. Some of the major characteristics of a psychotic person are: a serious mental illness causes hallucinations, delusion, faults in judgment, and other such processes is called psychosis. The primary symptoms of psychosis comprise of delusion and hallucination. That means a person is in a state of imagination and he thinks that he is living in that image rather than actual reality. The person who has psychosis tends to commit suicide or have suicidal tendencies. The above symptoms, if lasted for more than 6 months, can disable a person's functioning. The duration of the disease is not constant. The traditional curing or treatment methods include antipsychotic drugs. A stay in the hospital is a must when the phase of the ailment is acute. At times, when a patient goes out of control, tranquilization is used for immediate relaxation of the person so that he does not harm himself and others. The use of psychotherapy will also help in treating residual symptoms and cognitive symptoms of psychotic disorders. Types of psychosis: acute paranoia, an unrealistic distrust of others or a feeling of being persecuted; extreme stress, distrust, upset, hallucination, and isolating from the reality are some of the symptoms of a paranoid person. Schizophrenia. Schizophrenia is the most common and severe psychosis. The symptoms appear in the teen years. Disorganized speech, lack of emotional expression, and lack of energy are the major symptoms besides hallucination and delusions. It is related to multiple personality disorder. For example, the character played by Shobhana in Manichitrathada. Maniac depression. Serious mood swings become suicidal. Personality disorder. It includes paranoia and schizophrenia. Conclusion. Neurosis and psychosis are similar type of mental disorders. Neurosis is less significant and only a mental impact that can be cured by support from peers and also discussions with experts. Psychosis is a severe ailment that is both emotional and functional. The person with psychosis has madness and can harm himself if not cared properly. Hospitalization is must to some extent in neurosis and greater extent in psychosis. Thank you.